You're just too kind. But this is what I like to do. I'm an advocate by heart, and I really love helping people. I'm Nina Anderson. I own Life Academy Child Care Center, and I live in the 37th district. I have raised four daughters as a single mother. Thank goodness they are all residing independently. But at one point in time, I was the young single mother with four young children and finding it hard to make ends meet. As like any mother, you want what is best for your children, and I strive to make sure my girls had the best possible start and education. So I emphasize with parents who are in a situation I was once in and cannot afford to put their children in quality learning environments, as I know and understand how hard it is to make ends meet with unrealistic and minimal support and resources. Throughout my years of being in the early learning field and having my family childcare, I have seen many of the racial disparities that my people of color face. Even with being a childcare provider, it has been very tough given all the tasks we as providers have before us, such as caring for children, providing support for children and families, and providing community resources to families. In addition to that, we have to be attentive to our emails, hoping to find grants that we can apply for, praying for some kind of financial relief and funds to have the ability to provide quality learning materials for children in my care. I wish I had the privilege of not worrying about having adequate funds to maintain the essentials of daily living. Time is of the essence when applying for grants and or resources when we already have such a full plate. If there were more funds allocated to the early learning system instead of the K through 12 system, this would help alleviate most of these issues. There would be enough money to distribute to communities of color that are being underserved and marginalized. We would see childcare providers with better morale, providing equitable and quality care to all children alike, creating less opportunity for this systemic disparity. I always get that messed up. The system that is currently in place is like a domino effect in a sense. When families become ineligible for a copay that is unattainable, or if they lose their working connections eligibility, it creates a hardship, not just for the family, but also for me as a child care provider. When families are put in this situation, it puts me into a financial hardship also. I want to accommodate the families in order for the children not to be left behind, as they have been generationally to no account of their own. The co-pays that are required for families to pay are unrealistic, which is an issue that not only only concerns me, but also the parents, which in turn are the community. Given the increased strain on families due to COVID, co-pays should be more realistic or eliminated. I have a parent whose copay was $300 monthly. She's a single parent living with a relative while working part time to help support her household. There were a few months where she would not bring her child to my facility because she didn't have the funds to pay for childcare. This in turn forces us as providers to make difficult decisions. Like, should I discard the copay, take a financial loss, and provide child care support to the child and family, or turn the family down, and the family now has the stress of not having adequate child care? Let me put something into perspective for you. When you build a house, you plan to have it for a very long time. To do so, you have to make sure you build it with a sturdy, solid foundation. Then follows all the other layers, which in the end creates a safe home shelter or shelter. So when we think of children, why can't the education system focus their efforts into the early learning field? Because this is where our future starts. If we give all children the best foundation, meaning creating systems that provide families with realistic supports and services, allocating adequate funds for childcare providers to thrive, to create a thriving early learning environment, and creating exclusive funds and healthcare for child care providers, alleviating mental stress and strain. The reason this matters to me is simple. My facility currently serves 100% families of color, and all are on subsidy. This data speaks for itself. Some parents are more comfortable with their child having teachers that look like them, which is totally understandable because assimilation is something that plays a vital part in helping build up the child's culture, background, household values, and self confidence. Because we often see young children of color discriminated against and left behind academically, adding to the growing achievement opportunity gap. Granted, I didn't choose them, they chose me. And for that, I am grateful because I am a part of a much bigger picture that provides my community of people with a quality learning environment that will foster healthy, equitable citizens of our future. Thank you for listening.